Assalamu alaikum. I am Sayyid Muzaffar from Applied Psychology Department. I have a question about my profession. You are already doctor and you know very well कि जब हमारे पास एक ऐसा अब्यूज़ का पेशेंट आता है जिसके लिए दो लोगों का इकट्ठा बैठना
Brother, brother, I do understand Hindi and Urdu. It will prefer that you ask in English. Your English is very fluent. And most of the people understand English. So please ask the question in English. I won't have to repeat it.
Okay, okay.
And where are you? I cannot see you. Can you raise your hand? Where are you?
Okay.
Where are you? Yes, sir.
Yes.
And the blue shirt.
I want to ask about my profession, that some cases which deals by...
What's your profession? Can you repeat your name and your profession?
I am Sayyid Muzaffar Hussain.
Yes.
From Applied Psychology Department.
MashaAllah.
Being a psychotherapist, we deal some cases kind of like abuse. In these cases, when we take case history and we goes to treatment for those patients, for example, when goes to catharsis, and in these two conditions, in case history and catharsis, the both are needed to loneliness. In patient and therapist should be alone. And before in your lecture, you are asking then one person in sitting with opposite sex in the same room and both are alone, then third person will be sent. That's why I was asking, what is your opinion about psychotherapist, like in particular scenario in the catharsis and case history when the person is opposite sex?
Brother, the question that in doing psychotherapy, and many a time he has to be alone with the patient. So I said that a prophet said that if two opposite sex alone, the third person, what should he do? Point number one. I will answer in general, then come to your question also. Generally, as far as medical science is concerned, if you have a medical problem, it is preferable that a lady goes to a lady doctor and a gent goes to a gent doctor, generally. Not only psychotherapy, any therapy, generally. Whether it be general medicine, whether it be heart specialty, whether it be kidney, anything. If you cannot find a specialist in that field, you may be a lady and the heart specialist expert is a gent. In this case, you can meet the gent doctor, but there should be a lady also in that room. And this is ethics we are taught in the medical science. In the medical science, if I'm examining a lady doctor, a gent doctor is examining a lady patient, there has to be a female nurse, compulsory. Ethics of medicine. As far as consultation is concerned, talking about psychotherapy, yet, according to a prophet, you have to have a third person should be a lady. Because the beloved prophet said that if two namerama alone, the third person may be a Satan. Coming to your question. In Western world, there are many psychotherapists and psychologists who treat opposite patients. What happens? They do haram things afterwards. Do you know that? You're a psychotherapist. When you're sitting asked together with an opposite sex, if you're sitting with a lady patient alone in the same room, staring at her and talking to her for hours together, if nothing happens to you, you require a psychiatrist. You're a psychotherapist, correct? You're sitting with the girl alone in a room for hours together and talking to her. If nothing happens to you, there's something wrong with you. Do you understand? So mostly in the Western world, when the psychotherapists meet each other opposite sex and sit in a closed room, they even meet outside in a closed room. And do what? They break the trust of the patient and the doctor. But in Western world, everything allowed as long as it's with consent. In the Western world, you have sexual relationship, personal security, no problem, as long as they agree. have sex with your doctor as long as they agree it's allowed. In Islam, no. If you have to have sex, you have to marry. If you want to stay alone. So, as a professional Muslim, if you are a psychotherapist, see that you keep a nurse outside with you, not in your cabin, outside. When you have a female patient, that nurse should sit behind. This is Islam. If you cannot do that, then you change your profession. Do you understand? This is Islam. The best psychologist, there is no better psychologist than Allah subhanahu wa ta'ala. Instead of treating the patient, you will go on the wrong track. The patient may go on the wrong track. What if the patient lays the allegation that you are doing psychotherapy for 2 hours with her, and if she lays the allegation that you have misbehaved with you, what will you do? I'm asking a simple question. You are sitting 2 hours alone with a female, okay? And if she lays the allegation you misbehaved with her, what will you do? Oh, microphone.
I cannot justify and I cannot defend in this situation.
You cannot defend, so you will be behind bars, correct?
Yes.
So you take protection. What is your protection? Keep a female nurse.
Keep a female. Yes.
Female nurse, she can sit behind in the same room, so it doesn't break the hadith. When you are examining a female opposite sex patient, compulsory has to be a third person. Third person so that she is comfortable. This is the ethics of medicine. And it is the ruling of Islam. You may be a doctor, whatever it is, you have to follow the rules. If you are even a teacher speaking, giving tuition, you cannot give in a closed room. It's common. You cannot give in a public area, different. In a closed room, secluded area, third person is the devil. So whatever you do, even if you meet a specialist, you have to follow the rules. The rules and regulations have to be followed. This is Islam. That's the reason you find so many things, people doing haram activities, because they don't follow the rules of the Creator. Hope that answers the question, brother.
Thank you. Brother in the middle, please.